Okay, so myself, Dr.Shital Ghataliya, your faculty for Physiology. Welcome on the platform of Unacademy. I did MD Physiology from MP Shah Medical College and I'm educating MBBS and MD students. I have teaching experience of more than 17 years and I am one of the experienced faculty for integrated curriculum teaching. Let us go through some subscription details of Unacademy. With the Plus subscription, you can have access to both live as well as recorded classes. You can learn from the topmost educators of India. You can compete in live tests and quizzes. You can study on the device of your own choice. You can have access to the question bank having more than 25,000 questions in it. You can even have a printed notes available with certain subscriptions. With Iconic subscription, you can have access to the best from two of the best. Unacademy and Prep Ladder. With Unacademy, you will find various resources like well-structured live batches, recorded classes, competitive live tests and quizzes and many more. Unacademy and Prep Ladder. With the Prep Ladder, you will find clinical and integrated essentials, video lectures from Dream Team, rapid revision and snapshot and many more. So both are unique in its own way. Whatever is best suitable for you, that you can choose. Now Unacademy came up with some special class feature. Here the classes will be highly interactive. There will be also a poll for the learner. You can raise a hand, interact with your educator. You will never miss a class because Unacademy will send you regular notifications. Lecture notes are available and you can attend the classes from any time, anywhere. As I told you, there is a highly effective, updated and highly effective question bank. More than 25,000 questions are there in it, which are based on the latest exam pattern. It includes detailed explanation. These all are toppers of NEET PG September 2021. Congratulations to all the toppers from Unacademy. As I told you, there is a raise a hand feature. Now the classes will be highly interactive. You will be engaged with the quizzes, viva, doubt solving and many more. Unacademy Medical PG test is there. Free test reviews and plus batch test reviews. With free test reviews, you will find various resources like educator curated test series, FMG Grand Test Series, Study With Me YouTube Test Series and many more. Plus best test issues, you will find NEET PG 2022 Subject-Wise Test Series, NEET PG 2022 Grand Test Series and many more. So there are two batches, Focus FMG 2022 Comprehensive Batch, duration is 6 months. Already started from 15th of December. Target NEET PG 2022 Test and Discussion Batch, duration is 3 months, already started from 15th of December. So both the subscriptions, Iconic subscription and Plus subscriptions are available with various duration and different prices. You can use the code Shital10 to get additional discount. As I told you, there is a free test on Unacademy Educator Curated Test Series. Different scholarships are available for various ranks. So you can check with the ranks. Different times and dates are available. See the subjects. Use the code Shital10 to unlock the free test. 872878, that is a code to attend the quiz on app. Now you can check with your NEET PG preparation. All India mock test is available now. So you test your preparation journey. You can attend this mock test, enroll on the app. Use the code NPG10. Okay, so with this, on the February 19 at 9 a.m. you can attend the test. Use the code NPG10. Enroll for now. So now come to today's topic, that is Iron Deficiency Anemia. Hello Shlok. Today's topic, it is Iron Deficiency Anemia. So let us go through the first metabolism and how it get absorbed, what is the daily requirement and all of this. So this is important from MCQ point of view. Healthy adult contains 4 to 5 milligram of iron. Okay, in the body, healthy adult contains 4 to 5 milligram of iron. Where this iron is present, it is present in hemoglobin. Okay, then myoglobin. Myoglobin, which is an iron containing compound which is present in the muscle. Okay, myoglobin. 70% of the iron of the total body iron is present in hemoglobin. 70% of the total body iron is present in hemoglobin. 5% is present in myoglobin. Then in the store form, iron is present approximately 20 to 23%. approximately 20 to 23% of the iron is present in the store form. And intracellular enzymes, different intracellular enzymes, they also contains iron, that is 2 to 3%. Okay, different enzymes like catalase, cytochrome oxidase, peroxidase, these all enzymes contains the iron. Okay, so intracellular enzymes contains 2 to 3% of the iron. Cytochrome oxidase, catalase, peroxidase, these all are the intracellular enzymes which contains iron inside it. So if we look at the, now if we see the distribution of the iron inside the body, 70% is present in hemoglobin, 5% is present in myoglobin. In the store form, it is in 20 to 23%. Present, it is as a 20 to 23%. Intracellular enzymes contains 2 to 3% of the iron. So this way, iron is distributed. Adult requirement, daily requirement of dietary requirement. In case of adult male, it is 5 to 10 milligram per day. In adult female, it is 20 milligram per day. Female is having higher requirement, adult female is having higher requirement because of the menstrual blood loss. Out of the whatever iron you consume, out of that only 10% will get absorbed. Okay, only 10% of the consumed iron by diet, it is absorbed in the body. So normal serum iron, this is important MCQ, serum iron level of the body is 50 to 150 microgram per deciliter. This is important from MCQ point of view. Dietary requirement, adult male dietary requirement is 5 to 10 milligram per day. Adult female, it is approximately 20 milligram per day. Whatever you consume, whatever iron you consume, out of that only 10% will get absorbed by the body. So serum iron level of the individual is 50 to 150 microgram per deciliter. Now come to the metabolism, how mechanism of these iron absorption, how the iron will get absorbed in the body. See, iron gets absorbed in the body. There are two sources. One is non-heme source and another one is a heme source of iron. The word itself says non-heme source means the diet source. And the heme source, that is the iron which is because of the RBC lysis. Iron which is available in the plasma because of the RBC lysis. Whenever the RBC lysis will occur, hemoglobin will be released. Hemoglobin catabolism will cause release of the iron, free iron in the plasma. Right? So there are two sources of the iron, non-heme iron and another one is a heme iron. Now let us go through the first one, that is the heme, non-heme source of the iron. Non-heme source of the iron means we are talking about the food sources. Okay, so food iron is a non-heme iron. Majority of the iron which is present in the food is present in Fe3 plus state. Fe3 plus state, whatever iron you consume via food, mainly it is present in the ferric state. Okay, Fe3 plus state. Now, this Fe3 plus state has to get converted into Fe2 plus state to get absorbed and utilized in the body. So whenever the food you consume enters into the stomach, gastric HCl and vitamin C, these two are needed. Okay, HCl, gastric HCl and vitamin C. Gastric HCl will cause it will make it in a soluble form. Okay, so insoluble complex which is there, non-heme iron, Fe3 plus state, it will break it. Okay, so gastric HCl will make this iron in the soluble form and vitamin C will convert the ferric state into ferrous state. ferric state into ferrous state. Now this ferrous state, Fe2 plus state will enter into the intestine. Okay, it will attach with the brush border of the intestine and it will be taken up inside the enterocytes. Okay, it will be taken up by the enterocytes and then it will get utilized. Okay, so if we see the entire mechanism that how it reaches till the enterocytes, then the way is non-heme ion, means the ion which you consume by the food. It is present in Fe3 plus state. Okay, so to get absorbed, it has to get converted into Fe2 plus state. So for that, when it reaches to the stomach, gastric HCl and vitamin C will help for this conversion. Okay, so gastric HCl will convert it into the soluble form. Okay, that is why those people in which gastric HCl secretion reduces, then iron absorption will also reduced. Okay, iron absorption will also get affected. Vitamin C deficiency. In that case also Fe3 plus will not get converted into Fe2 plus state. So again it affects the iron absorption. So it means that anything which decreases the HCl secretion, or if vitamin C deficiency is there, it will cause anemia, right? It will cause iron deficiency anemia. So now come to the again the absorption part, that gastric HCl will convert it into soluble form, vitamin C will convert this iron into Fe2 plus state. Now this Fe2 plus, when it reaches to the intestine, it will be taken up by the brush border of the intestine inside the enterocytes. Then it will enter into the blood. So that is the one form. Okay, about the non-heme iron. Now what about the heme source? What about the heme source of the iron? For heme source of the iron, whenever there is a RBC lysis, lysed RBC will cause release of hemoglobin, right? It will release the hemoglobin. Released hemoglobin will be taken up by the macrophage system. Okay, macrophage system of the body. So these macrophages will cause the HB catabolism, hemoglobin catabolism. So it will cause formation of heme and globin part. Heme and globin part, right? Heme will be released iron and rest of the part is protoporphyrin 9, right? So that will get converted into biliverdin. And globin will go into the, it will cause release of different amino acids, and these amino acids will released into the amino acid pool. Now this iron is already in the Fe2 plus state, right? Then it reaches to the intestine. When it reaches to the intestine, again it will be taken up by the brush border and brush border of the intestine into the enterocytes, right? So the two forms are there now. Now we both the forms, heme source as well as non-heme source, both are present inside the lumen of the intestine. Okay, now let us understand how exactly the Fe2 plus will get reabsorbed. Consider this as a brush border of intestine. Okay, brush border of intestine. Now for heme source here, for the heme source there is a heme transport protein. Okay, and for the food source again there is a intestinal transport channel. Okay, so for the heme source of the iron, it will be taken up inside Fe2 plus. Okay, it will take the heme inside and it will release the Fe2 plus here, right? Then the food iron which is present in Fe2 plus state, that will be taken up by the transport protein inside. Okay, heme which is there in the intestine will be taken up inside the enterocytes. Okay, it will be taken up inside the enterocytes and releases Fe2 plus. Non-heme source will be there, Fe2 plus will be there, right? And it will also take the Fe2 plus inside. So if we simplify this diagram, it will be something like this. Heme transport protein will take the heme inside and Fe2 plus will be released. For the food ion, Fe2 plus form is already there by the transport protein. It will also take it inside. So Fe2 plus is there inside now, right? And this is, consider this as a blood vessel. So this Fe2 plus will be transported by active transport. It will be transported by active transport. Okay, this is the basolateral membrane of the intestine. By the active transport mechanism, it will be transported into the blood. Okay, once it reaches inside the blood, Fe2 plus will bind with apotransferrin. Understand the word carefully. Apotransferrin. Okay, means the one which is important for the transfer, right? So Fe2 plus will bind with apotransferrin and apotransferrin will get converted into transferrin, right? It will get converted into transferrin. Now this transferrin will transfer the iron to different tissues. Okay, so this is how the iron, whatever iron you consume or because of the RBC lysis, it will reach to the tissue again. Okay, non-heme source or heme source. For the non-heme source, this is the brush border of intestine, this one. Brush border of intestine. So whenever the heme is here, present here in the intestinal lumen, it will be taken up by the heme transport protein. Food ion, whatever you are consuming in the stomach, it will get converted into Fe2 plus state. So when it reaches to the intestine, it will be taken up inside the enterocyte. Okay, it will be taken up inside the enterocyte by the transport protein. Heme will also get transported by the heme transport protein. Finally, inside the enterocyte, Fe2 plus is there. These Fe2 plus will get transported into the blood by active transport mechanism. Once it reaches to the blood, it will bind with apotransferrin and apotransferrin will get converted into transferrin. Now this is transferrin, means the iron transport protein which is transporting the iron. Okay, so it will transport it to the different tissues. Okay, so this is how the iron get absorbed in the body. Iron absorption mainly, this is again important MCQ, iron absorption mainly occurs in the duodenum and upper jejunum. In the duodenum and upper jejunum. Okay, now come to the storage form. How the iron will get stored in the body. There are two forms. One, iron can be stored in the as a form of ferritin or as hemosiderin. As a ferritin or as hemosiderin. The iron in the tissue which will bind with the protein apoferritin and it will be stored as a ferritin. Okay, apoferritin, the one which is transferring is apotransferrin. It will get converted into transferrin, right? The one which is responsible for the transfer of the iron. The another one is for the storage, that is apoferritin. It will bind with the iron, get converted into ferritin and it will store the iron. It will release the iron whenever it will be needed. Right? The another form is hemosiderin. When iron intake is too much, it's too huge. In that case, iron will be stored in the form of that is iron cycle. How the iron will get recycled in the body. How the iron get recycled in the body. So this is about the plasma ion. Now you know that how the Fe2 plus ion is present in the Fe2 plus state, plasma ion. Okay, this plasma ion is is transferring, right? It is there with the transferring. It reaches to the bone marrow. Okay, it reaches to the bone marrow. Now what it will do in the bone marrow? In the bone marrow, it will bind with the specific transferrin receptors. It will bind with specific transferrin receptors, which is present on the surface of the intermediate normoblast. Try to recall the previous class, yesterday's class. Intermediate normoblast is a one stage of the erythropoiesis. Okay, whenever from the stem cell, from the pro-erythroblast, mature RBC is formed, intermediate normoblast is one stage, right? So there are receptor for this. Okay, on the intermediate normoblast is a state where hemoglobin appears, right? Hemoglobin appears. So it on the cell membrane of it, there are specific transferrin receptors are there on the surface of intermediate normoblast, okay, which helps in the hemoglobin formation. Okay, so this is about the bone marrow. Once in the bone marrow, mature RBCs are formed. RBCs are released into the circulation. Okay, it is having its a specific lifespan in the circulation, like it is 120 days, right? 120 days. So whenever the RBC lysis occur, again it will release hemoglobin, right? And hemoglobin will release the iron. Again this iron will enter into the plasma. This iron will again get recycled to the bone marrow. Okay, in the bone marrow, again on the intermediate normoblastic stage. At the intermediate normoblast stage, there are receptors for this. It will take the iron inside, helps in formation of hemoglobin. So this way iron will keep on recycled. Okay, this is how about the iron recycle will occur. So how does regulation will occur? Who will decide how much iron should be taken up inside? So for that there is a metabolic, this is important, metabolic blockage theory, you can say. That from the intestine, when the serum iron level reduces, then the number of the receptors present on the brush border of the intestine will increase. So it increases the iron absorption. If the serum iron level increases, then the receptors will reduce at the brush border of the intestine. Okay, so it decreases the iron absorption. If serum iron level reduces, then reverse will happen. Increase in the number of the receptor, increase in the iron absorption. So that is the metabolic blockage theory of iron metabolism. That is the first one. The another one is saturation. Saturation of apoferritin and apotransferrin. So they are not available to bind with the iron, right? So if they are saturated, hello issue, I hope you are doing well. So if the apotransferrin and apoferritin are saturated, so they are not able to bind with Fe plus 2, right? So they are not able to transfer it, they are not able to bind with it, right? So storage form and transfer form is not possible, so saturated, so it will reduce the iron absorption. Then decreases the rate of apoferritin synthesis by liver. If apoferritin synthesis by the liver itself is reduced when the serum iron level is high, so in that case also iron absorption will be reduced. Okay, then the third one already I discussed is metabolic blockage. Now come to the iron deficiency anemia. Okay, what are the different physiological and pathological causes? See, physiological causes means there is no underlying disease, but just simply there is some change in the condition of the body, which needs higher amount of iron. Okay, and pathologically means the iron intake and everything is normal, but there is some problem in the body which affects the iron absorption. That's why the person is suffering from anemia. Okay, so let us go through the physiological causes. Here, if the iron intake is reduced, okay, or if the demand is more, by the body if the iron demand is more, like pregnancy, adolescent woman, female who is heavily menstruating. Here the demand is more. Pregnancy, lactation, in all these conditions, iron demand is more. Okay, so that's why the normal, if you are taking the having a regular diet, in that case iron deficiency anemia will occur, because the whatever supply is there, that supply is not enough, the demand is more. Okay, the or if the absorption is reduced, absorption of the iron is reduced. So like in case if the you are taking some certain foods, like having the phytates and oxalates in the diet, which interfere with the absorption of the iron, so it will decrease is the iron absorption, though you are taking the enough amount of iron in the with the diet, but the absorption will be reduced by the certain other factors which are present in the diet, like phytates and oxalate. Okay, then if you are taking, if the person is having taking excess of tea or coffee, that will also affects the iron absorption. Female having repeated pregnancy, so there is no enough time to recover from the previous whatever changes which has been happened in the previous pregnancy. So repeated pregnancy, so body is not getting enough time to recover. Okay, so repeated pregnancy, female will suffer from iron deficiency anemia. If the infant is exclusively milk fed, okay, milk fed infants, so here in the milk iron is not there, right? So it will cause iron deficiency anemia. So these are the physiological conditions where iron deficiency anemia can occur. Either the intake is less or demand is more, or you are taking enough amount but absorption is less. Okay, or there are certain factors which are interfering with the absorption. Female having repeated pregnancy, exclusively milk fed infant. Here in the milk, the iron is not there, right? So because of that, iron deficiency anemia can occur. Excess of tea, coffee consumption, this can also cause iron deficiency anemia. Then pathological causes of iron deficiency anemia. In case of if the person is suffering from any kind of malabsorption, intestinal malabsorption, okay, like, because you know that in the duodenum and upper jejunum iron absorption occurs. So if the person is suffering from intestinal malabsorption disease, in that case it will affect the iron absorption. Chronic blood loss, okay, gradually on the regular basis there is some sort of the blood loss out of the body, like the person suffering from piles or having a repeated epistaxis or a gum bleeding, episodes of gum bleeding is there. So chronic blood loss can cause the iron deficiency anemia. Then in case of hookworm, this is important, hookworm infestation. Okay, so it will interfere with the iron absorption. In case of gastrectomy, this is very, very important. Gastrectomy, okay, removal of the stomach. Okay, so you know that to convert the non-heme state of the iron in the Fe2 plus state, we need gastric HCl. So if gastric HCl is not there, in that case, iron absorption will be affected. It means either there is a removal of the stomach or hypochlorhydria, means decrease in the HCl, or achlorhydria, means almost nil HCl, you can say. In all these cases, okay, all these cases, iron deficiency anemia will occur. So if we recall quickly, so in the stomach and in the intestine, two places are there where the iron will be metabolized, okay, and it will get absorbed. So in the stomach, if there is a problem, like if the hypochlorhydria means decrease in the HCl, or achlorhydria means almost absence of HCl, right? Or if the stomach is removed, then non-heme iron will not get converted into heme iron, so absorption is not possible. The other problem is with the intestine. If there is a intestinal malabsorption, in that case also it will get affected. Okay. Then apart from that, hookworm infestation, that will also interfere with the iron absorption. So these all are the causes of anemia, physiological and pathological causes of anemia. Now, what can be the possible symptoms of iron deficiency anemia? Different symptoms like generalized weakness, fatigue. Means easy fatigability, you can say. Person will complain of easy fatigability. Then palpitation means awareness of common features of anemia. Weakness, lethargy, irritability, unable to concentrate, headache. These are the common features, general features of anemia. So these are the symptoms. Now come to the signs. What the doctor will elicit, right? That is a sign. So different signs like stomatitis. You will find stomatitis. Okay, bad tongue is there. There will be koilonychia. Means dry, soft, spoon-shaped nails will be there. Koilonychia. Okay. Koilonychia. That is dry, soft, spoon-shaped nails will be there. Okay. So that you will find stomatitis. Specifically, you can say angular stomatitis is very common. Okay. Because of the iron deficiency anemia, overall immunity of the person will be compromised. So the person will have a repeated complaint of respiratory infection. Respiratory infection is very common with iron deficiency anemia. So these are the signs. Now come to the important investigations. This is very, very important for the clinical scenario based MCQ, you can say. Here, if we look at the red cell indices, MCV, MCH, MCHC. If we look at mean corpuscular volume, mean corpuscular hemoglobin, mean corpuscular hemoglobin concentration, all these will be reduced. All will be reduced. If you examine, if you prepare the peripheral smear, you will find hypochromic microcytic anemia will be there. Okay, this is very, very important. If you go for the cell counting, RBC count will be reduced. RBC count, total RBC count will be reduced. Hemoglobin content reduced. Serum iron level, this is iron deficiency anemia, right? So serum iron level will be reduced. Serum ferritin level will be reduced. Total iron binding capacity will increase. This is very, very important because large amount of these free will be present, right? Free state, because the iron level of the body is reduced. So total iron binding capacity will be increased. If you examine bone marrow, okay, it will show erythroid hyperplasia. This is very, very important. If you go for the bone marrow examination, you can see erythroid hyperplasia. And if there is a worm infestation, if you go for stool examination, you will find presence of ova cyst. Okay, in case of hookworm infestation, you will find this. Okay, so this is about the different investigation. Now you see this or look for the clinical scenario. The person is having the headache, lethargy, fatigue. Okay, with simple exertion, person will have a complaint of fatigue. If you go for the laboratory investigation, all these count, total RBC count will be less, hemoglobin concentration will be less, all indices, mean corpuscular volume, mean corpuscular hemoglobin concentration, mean corpuscular hemoglobin, everything, all will be reduced. If you go for the peripheral smear examination, it will show hypochromic microcytic. Hypochromic means decrease in the hemoglobin concentration. Micro means small, right? Cytic means cells. So cell size will be reduced. So hypochromic microcytic anemia will be there. Serum iron level, serum ferritin level will be less. Total iron binding capacity will increase. If you go for the bone marrow examination, you will find erythroid hyperplasia, means large amount of the series is getting diverted. Stem cell series is getting diverted to form more and more RBCs. Okay. Stool examination, if iron deficiency is because of the hookworm infestation, in that case, you will find presence of ova or cyst in the stool. Okay, so this is about the different types of investigation, lab investigations and its finding of anemia. So here some important key points I would like to highlight. Let us summarize this. Iron deficiency anemia itself is a short note. So if iron deficiency anemia is asked, you are supposed to write down, start writing with the iron intake, then mechanism of the absorption of the iron, and iron cycle, recycling of the iron, how the iron recycling occurs. Then different causes of anemia. Okay, if you enlist, you have to write down different causes of anemia. Then signs and symptoms, or you can say clinical features of anemia, iron deficiency anemia, and then go for the laboratory investigations. Iron deficiency anemia can be treated, if it is mild anemia, can be treated by giving iron, oral iron, or for moderate anemia, you can go for the injectable forms of the iron. So this is about the iron deficiency anemia. Let us compile if it is asked in the short note, how you are supposed to write it. You are supposed to write down with the definition, what is iron deficiency anemia. Then go for the intake of the iron, different resources, or you can say sources of iron. Then mechanism of absorption of the iron, then iron cycle. You are supposed to write down iron cycle, then write causes of anemia, signs and symptoms of anemia, and lab investigations of anemia. So this way, if iron deficiency anemia asked in the exam, this way you are supposed to write down. Always remember, whatever you consume, iron you consume in the diet, only 10% of that iron will get absorbed in the body. And main site of the absorption of the iron is small intestine, in the duodenum, and upper jejunum. It gets absorbed. Okay. So this is all about iron deficiency anemia. If you have any question, you can ask me. Okay, so after 2 to 3 minutes at 8:45, I will be there available on the app in open house session. Here we can discuss about the queries related to the iron deficiency anemia. You can talk to me. We can have a audio conversation and I will be there to solve your queries for this topic, iron deficiency anemia. After 2 to 3 minutes, you can join me on Unacademy app. Okay, on Unacademy app, you can attend the open house session. There, I will solve your queries. So Subscribe Unacademy Future Doctors channel. Study hard, study with us, study with me. Thank you so much.